The health sector plays an important role in today's modern society, both in terms of funding, third parties such as health insurance, and government influence. Because medical advances have increased life expectancy and citizens are being actively encouraged to take responsibility for their health, the number of people in need of medical care is constantly growing. As a result, public healthcare systems are starting to feel the financial strain. With such demand for medical care, health services and related public sector services are overwhelmed and are spending more time managing than treating. Moreover, how do you keep identity secure and prevent others from using it to receive care? About 500,000 Americans have had their medical identities stolen, according to a recent World Privacy Forum report, many racking up healthcare bills because of it. The challenge is to process administrative tasks faster, more efficiently, and with a reduced number of intermediate steps. The goal is to provide a single point of access where the patient only pay their deductibles as determined by the principle of the third-part payer. Most e-government programs in this area are aimed at much faster registration of patients at treatment centers. This can be crucial as the time wasted before a patient is seen can directly affect the effectiveness of some treatments. No upfront fees to pay at most health centers. Costs will be paid directly by health insurance authorities. Using e-health cards brings numerous benefits from an administrative point of view. Countries that have adopted this technology have noted a significant decrease in fraudulent reimbursement claims, as well as smoother, more efficient interaction between patients, healthcare professionals, and health insurance authorities. The French, for example, have used the carte vitale since 1998 and have 67% fewer administrative personnel per building than a comparable American establishment. Sésame Vital currently links more than 82% of general practitioners and 98% of pharmacists with the health insurance system for the benefit of millions of insured people who have the Vital card. In 2009, over 1 billion electronic claims reimbursement forms have been dematerialized, saving over 3 billion related paper documents. Taiwan, which implemented a national healthcare system in 1995, spent $108 million to implement a smart card system in the early 2000s. Their administrative costs are less than 2% of the total healthcare expenditure and possibly the lowest in the world. It is vital that private health insurance providers are incorporated and involved within established card schemes and then establish links between different countries' health schemes so that patients can receive effective health care anywhere in the world. For some lesser advanced countries, setting up an e-health system represents a quantum leap and is a critical stage in their development. These countries often evolve from having virtually no collective healthcare provision to adopting a modern, patient-centric approach. Professor Michael Mombusu, CEO of Caisse Nationale d'Assurance Maladie et de Garantie Sociale, said, "More than a card, it is a seed, a symbol for a new right, the right to social security for life." Any healthcare systems manager in charge of a multi-million euro budget understands the need for control. Smart cards are a proven technology and meet management requirement of cost efficiency, ease of use, and thanks to data already being stored on the card, reduced paperwork administration. Unlike paper documents that are relatively easy to forge, smart cards are in practice far harder to manipulate unlawfully. With a strong offline-online verification via PIN or biometrics, the unlawful use of lost or stolen cards being used to gain access to healthcare is severely limited. Anti-forgery elements that have been previously developed for banknotes and ID applications such as holograms, pictures, and guilloches can also be added to the card, ensuring further security for e-health users. Finally, access to sensitive data will be authorized in line with privacy protection requirements, meaning that medical data will only be shared between the patient and their doctor unless otherwise required. Using new technologies to simplify and accelerate information exchanges and moving away from paper has been a nationwide success for the French health system. Economic factors are key drivers for e-health programs. E-health ensures change from paper-based data management of citizens, insurance, medical records, and services to a paperless workflow. These systems require health professionals and insurance organizations to work with digital data, and based on this approach, cost reduction in operations and the reduction of fraud is balanced with privacy and security. The result? Total data privacy between doctor and patient.